Member for Peace River North.
It's sad that day after day we bring up example after example of the failures in our healthcare system that continues to seem to be downplayed by this government. And Honourable Speaker, I give another example of that. Morris is a senior from Fort St. John with a wife and family. A year ago, he was diagnosed with an intestinal blockage and placed on a surgical wait list. For 10 agonizing months, Morris was forced to manage his excruciating pain with Tylenol 3 and forced to make repeated visits to the emergency room, with days that he could only drink Glucerna for his nourishment. Finally, Morris did undergo surgery December 23rd, only to discover that cancer had been growing in his intestines for the last 10 months. To make things worse, not all the cancer could be removed, and now Morris's family is living in constant fear that the cancer may be rapid growing and late stage, and that he may tragically pass away before he receives treatment. Morris has been waiting for 10 excruciating weeks for his pathology reports and a specific diagnosis and medical treatment plan. Can the Premier finally take responsibility for this catastrophic failure in our healthcare system under his watch and give Morris's family the treatment he needs?
Minister of Health.
Thank you very much, Honourable Chair, and of course, Honourable Speaker, and of course, when such matters come to people's families, it has a devastating effect, not just on Morris in this case, but on the entire family. And so our hearts go out to them. A diagnosis that's discovered in the midst of another procedure is devastating. You're preparing for something profoundly difficult, and another diagnosis comes. The member knows that I will, in terms of the specific case, I can't speak of those specific cases in the House, he knows that, but he also knows that I will follow up with him on the specific issue. With respect to surgeries and surgical wait lists, I think the evidence is pretty clear, and BC's surgical renewal commitment is being followed by the entire country because of the very reasons he states why it's so important for people to get the surgery they need when they need it. It's why that we're doing record numbers of surgeries now, because people, regardless of whether it's surgery that involves life and death or someone's sight or someone's ability to move, all medically necessary surgery is important. And that's why we've expanded the number of operating room nurses, expanded the number of medical device processing technicians, expanded the number of surgeons, expanded surgical hours by 175,000. And still, as the member knows, it doesn't always work in that way for everybody. So we're going to continue to pursue those initiatives, and I'll be happy to talk to the honourable member about his constituent and their circumstances, as he would expect me to do, and I know the member has done, because we've done this in the past. We'll work through that with the family in the most appropriate possible way.